Hi everyone, Dr. Tam from Absolute Family Chiropractic here in Vacaville, California. Every week I try to give you some good tips on how to take care of your body, how to be healthy. I'm committed to your health. So the topic today is, we had a patient that asked me, hey Dr. Tam, how do I know if I'm a good candidate for spinal decompression? Well, I'll tell you, most of our patients that is on our spinal decompression table, whether it's for the neck and cervicals or whether it's because, for the lower back, usually when you first come into our office, I'll tell you exactly what happens. I'm very transparent in what happens in our office. When you come in and schedule an appointment with our office staff, you sit down with me or one of our other doctors and we sit down and do a consultation. I find out to see whether or not you have any previous injuries, any problems. From there, we go over what problems you're having. We take you through an exam. We take some x-rays. Now, we will take x-rays from the front and from the side as well. We had a patient this morning that came in. She's been suffering from the same neck pain for the last 7 years. And no one has, they just taken her around the ringers, right? They've given her medication, they've done physical therapy, it hasn't helped, they've given her exercises, they're recommending more medications, and no one has ever taken an x-ray, and she's had pain throughout her shoulders down into your hands. And the problem with, that's 7 years out of your whole life. So absolutely, when you come into our office, especially if you've had previous injuries, accidents, trauma, we're going to take a set of x-rays from the front and a set of x-rays from the side. This patient I told you about, she's been through gymnastics, she's ridden horses, right? And those sports when you're young are really, really high impact on the body. So she might be a good candidate for spinal decompression and combination with adjustments. She may not, but that night after we take the x-rays, we'll sit down, I'll study, develop, and analyze everything. And we usually invite our patients back the next time to come back and sit down and go over the x-rays, Some of them really enjoys having their spouse there as well. So we'll sit down with you and your loved ones or, anyone you choose. We'll go over the x-rays. After we go over the x-rays, we'll find out exactly, number one, what's wrong, why it's wrong. Is it something that's fixable or patchable, right? How long it's gonna take, what the cost will be. For any reason, if I can't help you, I'll let you know. Maybe it's because I didn't find anything. Or if I found something else outside of my scope of practice, we'll refer you to another specialist other than myself, okay? But that's usually what happens. And we have pro tennis players in here. We've got a lot of veterans in here who's gone through, parachuting, landings, and they've tore up their backs. We've got doctors in here. We've got contractors, nurses in here, because as a nurse, probably nurse is one of our, the biggest population of patients, because you're as a nurse, you're always bending over, you're helping patients. 300-400 pounds patients is not uncommon nowadays. And if you're having to do it by yourself or even with one help, you might tweak your back, We have students in here who's gone through different multiple sports, and it's very pounding on the body. We've got body lifters, bodybuilders in here from all walks of life, because what we need to see is if there is a decrease in disc height, and we're able to see that on x-ray, especially if you bring in your MRI from disc herniations and you're having a lot of pain from disc herniation, bulging disc, that's causing pain not only locally, but also going down your arms or going down your legs, you might be a good candidate for spinal decompression in our office, on top of adjustments, possibly. How do you know if you're a good candidate? Schedule an appointment. When you come in and you sit down with us, I'll tell you the truth. I'll let you know exactly, and I'll go over with you your x-rays with you step by step. It's not where I will take the x-rays and then just say, hey, here's your x-ray results and whatnot. You and I will actually sit down and I'll show you what a normal bone is supposed to look like and what normal disc height looks like. And there could be some of the bones on there that are normal, and some of the ones on there that are completely compressed or degenerated or arthritic that needs to be addressed. Come in for a consultation. If you're not sure if you're a good candidate for spinal decompression, for chiropractic in our office, come in, give us a call, talk to me, and let's go from there. I don't ever charge anyone to sit down for a consultation and really find out what the problem is, and we'll go from there. All right, if exams and x-rays are necessary, we'll move forward. If I don't believe that I can help you, we won't. All right, I really hope this helps. Have a great day.